Welcome to the Methodist Total Joint Program. Thank you for giving us the opportunity to take care of your arthritic hips and knees. We'd like to take this moment to provide you and your family with all the information that is needed so that you can experience a seamless total joint replacement. We plan to deliver the best outcomes using protocols based on evidence-based medicine. Prior to surgery, you'll need a medical clearance from your primary care physician. They'll fill out the form and send it to us. Once we have the form, we can proceed with the surgery. If we don't receive the form, there can always be a delay or cancellation of surgery. You may have to get further clearances such as cardiology, nephrology, or pulmonology based on the recommendations of your primary care physician. These forms also will have to be returned to our clinic before we can go ahead and do the surgery. It is important to make sure that you get your blood work, your urine analysis, your EKG, and your chest x-ray within 1 month of your date of surgery. Anything that's done before will have to be repeated as per protocol. Please decide where you would like to have your physical therapy. The physical therapy department here at Methodist is very well versed in our protocols and do a phenomenal job. If you decide to go elsewhere, please share with us the information as to where you'll be going so that we can share our protocols with your physical therapists. You'll also receive a machine that will help ice your extremity as well as do compressions so that you avoid blood clots. A separate company will be contacting you to make sure that you have the delivery of this machine. Every insurance company has different policy as to the coverage regarding this machine, so please contact your insurance companies to find out. If there's any issues, please feel free to contact us so that we can see if we can expedite or assist you in getting this machine. In addition, you'll be receiving special wipes to clean and prepare your body prior to surgery. The information about how and when to use the wipes are provided in your folder that will be given to you. A member of our surgical nursing staff will be contacting you the night before surgery. They will inform you what medications you need to take and what you should avoid. They will also tell you what time to arrive for registration so that you're on time for your procedure. Lastly, hip and knee replacements will be going home the day of surgery or the very next day. As regulations have changed, we can no longer send those patients to inpatient rehabilitation or outpatient rehabilitation facilities. On the day of surgery, make sure to take the medications that you have been informed that you can take by the nursing staff with only a sip of water. Make sure you bring all your medications with you to the hospital. Please make sure to bring comfortable shoes and clothes that are loose-fitting so that you can wear them as you do your post-operative therapy. Make sure to avoid bringing any jewelry to the hospital. Following registration, you'll be going to the pre-surgical area. It is at this point that you will be changed into a gown. The nursing staff will interview you and will place an IV in your arm. You'll be transported to the holding area prior to surgery, where you will meet your surgeon and your anesthesiologist. As you are transported to the holding area, getting ready for surgery, your family will be directed to the family surgical waiting area. It is at this point that your surgeon will answer any final questions you may have, review the risks and benefits, mark the extremity that will be having surgery, and make sure that they sign their consent. Similarly, the anesthesiology team, which comprises of the anesthesiologist and the CRNA, will come and meet with you. They will go over the risks and benefits and sign their consents. It is at that time that they will also proceed to give you a nerve block to control your pain during and after surgery. You will then proceed to surgery. Once surgery is completed, you will be taken to the recovery room, and at that time, your surgeon will go and speak with your family. After surgery, your pain will be managed by pain medications given through the IV or by mouth, and any nausea, vomiting will also be taken care of by the recovery room nurses. As you recover in your hospital stay, your pain will be controlled by the nerve block that you receive by the anesthesiologist, as well as IV pain medication and oral pain medication. We have a strict protocol that we follow so that we minimize the amount of narcotics patients receive. We will be using the ice machine to make sure that your surgical extremity has ice, and a compression machine to make sure that we can help prevent lower extremity blood clots. 8 hours after surgery, you will receive an injection in your belly that will help prevent blood clots. Your primary care physician or a hospitalist physician will come and make sure to resume your home medications. The goal of physical therapy after surgery is to make sure you're up and about the same day. If we can get you up in a few hours after surgery, that is very promising. We want to get you up and moving so that we can avoid blood clots, which in turn could lead to other complications in your recovery process. At Methodist Hospital, we strive to make sure that our physical therapy team and our nursing team work hard to get you up and about at least 2 to 3 times a day. That mobility allows you to recover in the most expeditious and safe manner. The physical therapist and the occupational therapist will work with you and make sure that you're well informed on how to transfer out of your bed onto a chair, onto a commode, and they will also help and educate you as to how to use your walker appropriately and how to navigate going up and down stairs in a safe manner. Let's talk about recovery. After surgery, our goal is to have you come in and see us for a wound check and a dressing change at least 1 week or 10 days after your surgical date. Your individual surgeons will determine your follow-up appointments, and the office staff will make sure that you're well informed of when you need to be seen. We highly encourage that you avoid any bathing, showers, bathtubs, jacuzzis, swimming pools for at least 2 weeks after surgery until the wound is closed and well healed. If you have any questions, please don't hesitate to call our clinic. It is quite possible that after surgery, you may have swelling in both legs, particularly more so in the surgical leg. It is for this reason that when you're sitting or laying down, try to keep your leg elevated and iced. If you have any calf pain, shortness of breath, or chest pain, please make sure to call 911 or go to the emergency room as you're concerned of a blood clot. We highly recommend that you abstain from smoking, using recreational drugs, and alcohol. The use of recreational drugs and alcohol often impede judgment. And when judgment is impeded, there's always chance of injury from fall, and this in turn could compromise the overall outcome of your surgery. As you're recovering after surgery, maintaining a well-balanced diet is critical. Having the appropriate nutrients and higher consumption of protein will help with your wound healing and your overall recovery. Your outpatient physical therapy will start the day after you are discharged from the hospital. You will have to do physical therapy 3 times a week for 4 weeks. During the phase of your recovery, it is important to make sure that you are taking some form of anticoagulants to avoid blood clots. Depending on your surgeon's preference, you will either go home on aspirin or some other form of anticoagulation. It is imperative that you take those medications as prescribed. To control your pain, we will be providing you narcotic oral pain medications. We prescribe these medications for up to 6 weeks. We believe that by that point, you should have had most of your pain resolved. If you continue to have issues with pain, we may refer you to a pain management physician. Finally, let us review the risks and benefits of hip and knee replacements. The benefits are to get you to ambulate pain-free without a cane, get you to have a quality of life that you can enjoy. The risks of surgery include, but not limited to, infection, injury to nerves and vessels, fracture, hardware failure, clot to the leg, clot to the lungs, anesthesia risk, and death. If you have an infection, fracture, hardware failure, repeat surgery may be needed. Thank you for giving us the opportunity to take care of you here at the Methodist Hospital's Center of Excellence in Total Joint Replacement. It is our pleasure to help you regain the quality of life that you have wanted. Please feel free to contact us at any time, and we'll be more than happy to return your calls and answer your questions. Thank you very much.